Hello everyone, today I'm going to show you how to strengthen your hip abductor by performing a side-lying hip abduction exercise, right? So what we are going to do is to lie to our side. So if you're lying to your left side here, that means you're strengthening the right hip abductor. So what's different with the clamshell exercise is that this time I'm straightening the knee fully until I reach here, right? So once we are in this position, lift up your leg until about here, right? I don't want you to overdo it because when you are lifting up too high, you are already using your oblique muscle to do this. So try to lift up just above your body like this, right? Just halfway until you can feel your hip abductor here firing, squeezing really hard. And once we are in the top position, come back down with good control as usual. Okay, let me show you again. Lift your leg up from the side, squeeze the muscle in this region, come back down with good control. One very common mistake that a lot of patients will do is that they will rotate their hips slightly outwards when they are doing this exercise, right? So when your hip position is already like this, the muscle that you are targeting is no longer accurately the hip abductor. So to make sure you are doing it correctly, align your pelvis perpendicular to the surface you are performing this exercise on. So if she is lying down like this, then she will have the perfect alignment to perform a hip abduction exercise. Another common but often neglected mistake is on the ankle. A lot of patients will point downwards like this, and this will cause your calf to tighten too much and you will lose a lot of stability from the hip abductor. I don't want you to do that. Ideally, I want your toes to be pointing towards yourself when you are doing your hip abduction exercise, right? Okay, so the third common mistake that I see a lot of patients do is that they will start to, when they lift up, rotate the hip like this, right? Okay, so sometimes they start very accurately from here, but because their hip abductor is weaker, when they lift up, they are rotating to the top, right? So I don't want you to do that. Make sure your toes is firmly pointing towards the front but not towards the ceiling. Okay, let's show everyone once again. Go down and then go up, squeeze for a brief pause and then come back down with good control. Last but not least, pay attention to your knee joint. A lot of patients, they will bend very slightly over here and this will cause your whole lower limb, the kinetic chain, to lose stability and you won't be able to contract accurately anymore. So make sure the knee is 100% straightened, fully locked here before you perform the exercise. Lift up, hold, come back down, good control. One significant advantage this hip abduction exercise has over the clamshell exercise, even though both of them are targeting the same muscle group, is that you can easily add more resistance by using an ankle weight like this for the hip abduction exercise. So just tie a weight on your ankle, lift it up. You are going to feel more resistance to challenge the hip abductor muscles here.